Assalamu alaikum. I'm Dr. Abdul Latif Shahid, Associate Professor and Head of Department Pediatric Orthopedic Surgery, the Children's Hospital and University of Child Health Sciences, Lahore. Today, I'm going to discuss about basic concepts of DDH, what is DDH, why this term is used, and which term were used in the past. Before going into the detail of this disease, two things are very important regarding this disease. It is a spectrum of disorders. Spectrum means combination or collection of disorders, and second thing is it is an developmental abnormality. It is not a congenital deformity. Congenital means present at birth, while developmental means evolves with passage of time. So, definition of DDH is it is an abnormal development of hip joint due to capsular laxity and prenatal and postnatal positioning resulting in failure of maintenance of femoral head within acetabulum or femoral head coverage over a period of time and present in different forms in different ages. What is meant by different forms and different ages? In one extreme, baby born with femoral head in acetabulum, and on examination, femoral head cannot be subluxated or dislocated. On the other extreme, baby born with femoral head is already dislocated and femoral head cannot be reduced. In between these two extremes, there are different entities. One entity is femoral head is within acetabulum but can be subluxated or dislocated and then it is reduced. Another extremity is femoral head is already dislocated but can be reduced. Another entity is femoral head is already dislocated and now cannot be reduced. So these are different entities. That's why DDH is called spectrum of disorders. In the past, it is it was called CDH. CDH means congenital dislocation of hip. Now, with better understanding and knowledge, it is known that actually CDH is a type of DDH and this CDH is called pathological hip dislocation. And this CDH is present in neuromuscular disorders in syndromic babies like arthrogryposis and myelomeningocele. So, this DDH is a spectrum of disorders. Hip may be subluxatable, hip may be dislocatable, hip may be dislocated and can reduced, hip may be dislocated and cannot be reduced, and sometimes femoral head is within acetabulum, but acetabulum is not fully developed. That is called acetabular dysplasia. So acetabular dysplasia, subluxation, dislocation, all these entities are included in DDH. So in a nutshell, DDH is a spectrum of disorders. It is a developmental deformity. It is not a congenital deformity. Its one form is congenitally present that is called congenital hip dislocation or teratological hip dislocation. DDH evolves with passage of time. Sometimes at birth, hip joint is normal, but later on there is DDH. Sometimes at birth, hip joint is unstable, that it can be dislocatable or subluxatable, but with the passage of time, this unstable hip became stable. So there are different entities, different forms at different ages. That's why it is called a spectrum of disorders. There is abnormal development of hip joint due to capsular laxity, prenatal and postnatal positioning, and resulting failure of maintenance of femoral head within acetabulum or femoral head coverage over a period of time, and baby present in different forms in different ages.